My name is Thaderine. I grew up in New Orleans, met my husband there. I have 5 kids and now 3 grandkids. Being a grandmother is the best.
Look at us.
My husband, his kidneys had started to fail. He was feeling it in his body. He got to the point where he was going to have to go on dialysis.
Thank you so much for coming in today. These are my favorite visits.
If the kidney fails, the rest of the body doesn't work, and it supports all the other organs. So for every other part of your body that needs to function, your kidney needs to be there.
Patients with hypertension, diabetes, have a history of kidney disease in their family. Unfortunately, their trajectory is dialysis, but the alternative treatment is receiving a kidney transplant.
He could tell that he couldn't walk hills with me like he used to. It was more difficult to do just some of those daily functions. So when we realized that he was in decline, I asked if I could be a donor.
Living donation is very important because the supply is limited.
Based on your blood type, the waiting times for a deceased kidney transplant is about 6 to 10 years. But with living donation, that transplant can actually occur within months, and that is one less person on the waiting list that's waiting for another deceased kidney transplant.
I felt that as long as I was in good health and as long as my intent was to continue to have a healthy lifestyle, I felt comfortable that I could live the rest of my life without it being compromised in any way.
Living donors live a full life. This has been well studied. We do everything we can to make sure that you have enough kidney reserve that you can donate. That's part of the reason why the living donation process is so thorough and measured.
They are trying to make sure that you are sure that this is something that you want to do. And all through that process, they were paying attention to what my blood work looked like, what my health stats were looking like, to make sure that they didn't compromise my health and my future health.
Let me first do your physical examination, and then we'll look at your labs, and we'll talk about how this is going to happen and the answers.
The concern I see the most voiced by potential donors is actually not about the surgery. It's about the fear of not being a match. And now, because of what we call the chain donation, this problem has been resolved.
Paired donation is when an incompatible pair, a potential donor and a recipient, are not compatible. They can be entered into this kidney paired donation where they can potentially receive a living donor from another pair that is incompatible with one another, and a kidney swap can occur.
I was able to donate a kidney to someone else waiting on a kidney, and their donor was able to donate their kidney to my husband. I thought that that was fantastic, actually. You know, you don't always match with your mate, but you're still interested in trying to help them get a kidney faster.
The kidney can start to work harder immediately. The remaining kidney grows. It's not doubling in size, but it grows between 10 and 20% to eventually even work better. With the laparoscopic surgery, the recovery is really fast. The patients stay in the hospital 1 or 2 days after the surgery. Most patients would say that it's almost like nothing happened to them after 4 to 6 weeks.
It was nice, you know, a nice moment of being intimate and him just being so thoroughly grateful that I was going through the process for him and with him. I remember just feeling relieved that he was going to get his kidney. The surgery was definitely minimally invasive. I went home the 3rd day and my husband came home the next day. I would say I was back to normal probably within 6 weeks.
Thaderine is one of those kidney donors who has thrived and more or less not noticed that she only has 1 kidney. So her 1 kidney grew a little bit bigger, worked a little bit harder, and is doing more than enough job for only having 1 kidney. Her husband, his last kidney numbers were better than I've ever seen them.
My experience with Stanford Hospital, I can't praise them enough. Everyone gave us the attention we needed, the reassurance we needed, and the comfort in knowing that we were going to be well taken care of.
Thaderine, good to see you again.
Hi, Dr. Ahern. It's good to see you too. When I looked at my blood work, it looks like things are holding, and I had my graduation checkup a couple of weeks ago, and my numbers are getting even better. I am biking again.
If you're interested in becoming a donor, you can go to our Stanford Healthcare kidney transplant website and find more information. We also have our living donor number on there as well that you can call and ask any questions that you have.
It's one of my greatest accomplishments, I think, is helping out not only my husband, but another person continue with a healthy life.
You can save a life. Learn more about living organ donation at stanfordhealthcare.org/livingdonor.